Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to go over acupuncture and how it may help complement your rehab and recovery after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button, turn on the notifications to catch all of our latest videos. So when it comes to rehab and recovery after surgery, of course, physical therapy, exercise, physical activity is going to be the main component of your rehab. But there are a handful of different complementary or alternative therapies that can be incorporated in your rehab and recovery, and there's many patients who do utilize some of these alternative therapies, acupuncture being one of them. So what is acupuncture? Well, it's a type of traditional Chinese medicine. It involves inserting thin needles into specific points of the body to stimulate energy flow. This is known as qi. QI, it's spelled. And it's supposed to promote healing and have a positive effect physically, mentally on the body. Now, acupuncture has gained popularity in Western medicine and Western practices as kind of an alternative therapy. It's used for a variety of different health conditions. It's used for pain management, and it can be used for part of your rehab and recovery after a surgery, such as a knee replacement. There's a bunch of different types of acupuncture. So there's traditional acupuncture coming from Chinese medicine. There's electroacupuncture. And there's also dry needling. So dry needling isn't really acupuncture, it's different, but it does use those needles in a specific way to help with pain relief and pain management. We won't talk too much about dry needling. We might save that for another video, but it is similar in that it's using the insertion of needles, but there are a lot of differences as well. So what are some reasons you might use acupuncture after knee replacement surgery? Well, probably the main reason is for pain management or pain relief. Acupuncture has been found to be particularly helpful for some people. Sometimes in the early stages, as you're rehabbing and recovering, you have a lot of pain, stiffness, inflammation in the body. It can help as a complement or as a secondary thing to use besides the traditional pain management. So besides pain medicine, besides exercise and stretches, ice, heat, acupuncture can be used as well. Potentially, it may be helpful for reducing inflammation and swelling, improving circulation in the body and around the knee joint. This is debatable depending on what research you look at and things, but a potential benefit in reducing inflammation and swelling. With that pain relief, you might notice increased range of motion, increased ability to move and bend and straighten your knee. You might notice some support from a mental health and a stress relief aspect. So acupuncture has been shown to help with things like anxiety, depression, frustration that can often accompany the rehab and recovery after surgery or continued pain or continued difficulties. So acupuncture can also help on that psychological aspect. It can release endorphins and stimulate the nervous system in a positive way, which can help with mood, emotion, stress. And it can just be a good complement to the physical therapy and the rehab and recovery you're doing. Think about if you have pain relief, if you have improved stress management, improved control of your frustrations and anxieties, that's just going to help you better tolerate the exercises and activities you're doing with physical therapy and otherwise. So when should you start acupuncture after a knee replacement? Usually those first few days and first week or two, you might want to hold off. Just get into the flow of your physical therapy and rehab, see how it's progressing, see how it's going, get your inflammation, get some of that swelling under control, get some early range of motion and strength gains. But if you're continuing to have issues with pain and it's not really well managed and you're a number of weeks or months out from surgery, that's usually when I would recommend trying some of these complementary therapies such as acupuncture. Usually acupuncture is done once or twice a week for a number of weeks. And then usually as things improve, hopefully you kind of taper off as you progress and as you go along. But there's no set amount of frequency or amount of times that you should do it. Usually you should listen to the acupuncturist, would probably have the best advice for you in that regard. You also want to make sure you're talking with your healthcare providers, so talking with your physical therapist, talking with your surgeon, and just saying, hey, I'm looking at acupuncture to maybe help with some pain relief. Most of the time they'll say, go ahead, give it a try, but there might be some certain reasons why they might say, let's wait, let's not do that right now. So it's always good to have that conversation with your healthcare providers as well. Now, there's a lot of different research about acupuncture and the different potential benefits, but some of it shows that it can help with post-surgical pain, such as after a knee replacement. It can help with improving range of motion, flexibility, and overall that can lead to improvements in your function and your activity tolerance after surgery. Now, we do have to understand that acupuncture is not a one-size-fits-all solution, so it doesn't necessarily work for everyone. Although a lot of people experience benefits with it, some people may not find it as helpful. And I would never recommend that it be a substitute for your traditional rehab and recovery and speaking with your doctor and working with your doctor and your surgeon and your surgeon's team. But it is a good complement for some folks after surgery. You want to make sure that you are choosing a qualified acupuncturist, someone who is licensed and trained. You want to be aware that there are some small risks of possible side effects, such as bruising or soreness where the needle sites are, and just some general fatigue some people experience as well. And just understand that there is a cost to it, so not very often will your insurance cover the cost of seeing an acupuncturist. So there will be some cost involved that you want to consider, and consider if the potential benefit is worth what that cost may be. So I hope that gives you a good summary of acupuncture and the potential benefits of acupuncture after knee replacement surgery. Of course, leave your questions, your comments, and feedback below. I love to hear it, and I try to get back to every person I see. Thank you very much for watching.